welcome to Jillian's Clinical Corner, episode 11. Woohoo! We're over the 10 episode hump. I'm not sure if that's a thing, but still very excited that you're joining me and that you are watching. So last month I discussed something we're all experiencing right now, which is ABA provided via telehealth. So this week, I'm going to discuss something equally applicable to this time, which is parent training via telehealth. So as discussed last month, telehealth or telemedicine is something you may have experienced in the past. However, never to a volume like this, and probably not to provide ABA services, although some people have provided and done some research with ABA via telehealth, not to this level. We are completely inundated with telehealth options for our own doctors, our pediatricians, mental health therapy services, and also to provide ABA. Remember from last month, or just from your experiences, telehealth is a way to connect via video and audio to provide services to individuals remotely. Depending on the client and what's approved through insurance or through the school or whatever way you're working with your client, you may be providing direct therapy, supervision, and even parent training. What does parent training look like via telehealth, and is it even possible? The answer to is it possible is a huge yes. If you could believe it, I found research from 2013 from Vismara et al. From the Journal of Autism and Developmental Disorders that researched this exact topic, parent training provided via telehealth. This means that researchers completed this prior to the current pandemic and necessity for telehealth services. This means researchers were looking into this a while ago and maybe even further back than 2013, but this is the article I decided to focus on today. These researchers found that telehealth may support parents and children developing their skills. For parents, the ability to implement interventions, and for children, to increase their verbal language and joint attention skills. These researchers conducted this research at that time because they were looking for additional resources to provide needed services. Did anyone ever experience that with families where you're trying to provide in-person parent training, but the parents are at work when you're there, and then when they're home, you're already gone, and you can't find an overlapping time between their schedule and your schedule? In the future, or even right now while we're actually using telehealth, you might be able to find that time. And this closes the gap between being able to provide and not provide parent training. What does parent training look like via telehealth? Some things are going to be exactly the same. You're going to use behavioral skills training to teach parents skills. You will educate them on ABA procedures that you are going to use and that you're going to ask them to use with their children. You will answer their questions. So at the core, parent training can be done in the same way as when you're doing it in person. But at this time and via telehealth, there are a few additional factors you may want to consider. This is from Psych Central's website, and it's included in the references. But there are a few additional areas we should pay attention to right now when we are providing parent training via telehealth. First, keep in mind that everyone is in a different situation right now. Some families are home and feel they have more time than ever to devote to telehealth and other activities. Some families are home, but they're stressed about not receiving a paycheck, and maybe they're holding off on services because they're worried about it. Some families are home, but mom and dad are working from home, and their job may be very understanding, and they have time to devote to parent training. Some families are home, but mom and dad are working from home, and their jobs are not very understanding, and they don't have time to devote to parent training. And these are just 4 scenarios that I could easily think of that I've described here. So even though things are slowly returning to normal, keep in mind that every single person is experiencing this quarantine differently and has different stressors at this time. So keep in mind, you might have a parent who is usually available for weekly parent training, now suddenly not available, or the opposite, a parent who is never available, now suddenly is available. So quarantine can cause changes in people's schedules. Embrace all of this with empathy and understanding. This is one of the biggest ways we can approach parents right now when discussing and providing parent training. That's not to say it's not important all the time, empathy, but we're talking about telehealth services and how to provide them right now. Here are the recommendations I spoke about from Psych Central. Be positive and encouraging and express the benefits of the service. Positivity can go a really long way, especially right now. Parents might be feeling discouraged in their overall situation with the quarantine or just stressed about what's going to happen. Positivity and encouragement may help them more than you know. Reinforce the behaviors and participation of the parent and or the client. This one is so huge, but I also feel like it should be kind of obvious. Being that we're behavior analysts and we provide reinforcement as one of our major features of our job, but I think that what's important is that we remember to provide a lot of reinforcement to parents for their participation in parent training and for implementing interventions and teaching skills. So we all know, we got to provide a ton of reinforcement for clients following directions, but you also have to provide a lot of reinforcement, probably through social praise or just general conversation to the parents for following the programs and the procedures that you put into place. Provide continued follow-up about the client's experience and problem solve any potential barriers or concerns that arise. So connect with the family about what their biggest problems and concerns are right now. Focus on natural environment training as opposed to strictly discrete trial instruction. This can be very helpful because this is how parents should work with their kids. They're not going to be doing a lot of sitting down right now at the table and working through discrete trial. Using natural environment teaching makes a little bit more sense, especially at this time when we're providing services via telehealth. Find ways to help families improve their quality of life by focusing on socially significant topics and realistic goals. Keep in mind that parent training goals may be different now than when you were in person. Connect with the parents. Make sure you're in touch with what they really want to work on right now. Keep in mind, even though it's a challenging time, amazing things can come out of this time when we're able to connect via telehealth. If you aren't currently providing parent training, see if you're able to, and at the least, make sure to connect with your client's parents, reach out to connect to them and provide support, and see if you could schedule some parent training. Thanks everyone for watching. I hope you enjoyed this episode of Jillian's Clinical Corner. Thanks again.